Hello and welcome to the Health Q channel, the health awareness channel where our mission is to motivate you to look at the brighter side of the health. This is Friday, and Friday we share videos about kids' preventive health. And today we are going to talk about some of the complications that exist following fracture in your kids. This complication awareness helps you to identify them early and help you to treat it or else correct it as soon as possible. So, if your child is going through fracture or had gone through fracture in previously and now is in the state of rehabilitation, this video is very important. So make sure to watch this video till the end. Let's get started with today's video, and these are some of the possible complications of fracture in your child. So let's first talk about some of the acute or else immediate complication that happens following fracture. And the first complication that comes is the injury to the adjacent structure of the fracture site. Fracture is in break in the continuity of the bone, but the bone is surrounded by different structures like veins, arteries, muscles, nerves, capillaries, etc. And these structures are equally more prone to get damaged following in fracture. Hence, the first complication or as the most immediate complication of fracture could be damage to these structures. The second common complication following in fracture that happens immediately is called as compartment syndrome. Now, what is in compartment syndrome? Compartment syndrome stands for a problem or else a condition where injury to one fracture site leads to compression of the arteries or else a vein around that area, leading to poor blood supply on the other compartment of the structure or else around the area. So, for example, if the fracture has happened on the thigh region and this impacts or causes a compression on the artery or else other structures, there could be a loss of blood supply on the leg, leading to pain and sometimes bluish discoloration of the skin on that area, and sometimes also damage to the vascular structures of that area is fracture blisters. Fracture blisters are something where there are this tense vesicles which are erupted or is formed exactly next to the fracture site. This looks very swollen but are not painful. And the good news is these are very rare. Open fracture. This is also an immediate complication where the bone gets penetrated to the skin, leading to and damage to the surrounding structures of the area, and here the break of the bone is much more, and this happens if the patient is not immobilized immediately after fracture. If the patient tries to move post fracture, they have this higher chances of getting open fracture. Now, moving to the chronic complications or as complication that happens post fractures following few days. Now, this complication mostly happens if the cast is not applied properly, if patient tried to do weight bearing activity or any other movement which are not allowed to be done, and even sometimes if the overall health and well-being of the patient is not well. Now, these common complications are: first one, delayed union. What is delayed union? If the immobilization of the fracture site is not done, then the bone will take much more time compared to the normal situation where the cast is done to unite with each other and to get joint and get normal. The second complication is called as non-union. This also happens when the fracture cast is not applied or else the fracture area is just left without any treatment. Non-union stands for the bone not being joined absolutely. Third is malunion. Malunion stands for wrong way or else bone which are fractured getting reunited but in a wrong pattern or else in a wrong direction. This leads to abnormal protrusion of the bone at the fracture site, leading to compression of other structures, and this leads to long-term pain and sometimes deformities. Fourth complication is osteomyelitis. Osteomyelitis is an infection in the bone. This is mostly common if the fracture wound is kept open or else the fracture wound area gets wet or else is always moist or damp. This gives birth for the germs to penetrate, and this leads to infection of the bone. The next complication is deformity. The fracture site after cast removal is not exercised properly, then the child tends to develop certain deformities, which means that the leg or hand or any fracture site stay in an awkward or else abnormal position, which is not possible for them to correct it themselves or else require some passive effort to bring it back to the normal position. Hence, it's very important that deformities should be prevented by incorporating exercise regime after cast removal. Now let's move on to see some of the serious complication, or else sometimes you can say life-threatening complication post-fracture. And the first complication is hemorrhage. If there is an increase or a sudden loss of blood following a fracture, this happens absolutely after an open fracture, then this might lead to a lot of blood loss, leading to death and some serious complications. The second kind of serious complication following a fracture is rhabdomyolysis. Now this is a rare condition but is a life-threatening condition. In this, there is a damage to a muscle. Damage to the muscle leads to death of the muscle fibers, and this dead muscle fibers leads to exclusion of all the internal content present in the muscles. And this release of this content is open and is moving in the bloodstream, gets mixed with the bloodstream, which damages the kidney and is a life-threatening situation. But the good news is, if this is identified early on and if it is corrected, it is very well managed with the help of medical intervention. Now, why does this complication happens? Now, mostly this kind of complication happens if there is a crush injury following a fracture. This happens mostly while road traffic accident, or else when there is a heavy load falling on an area or else in structure that has got damaged. If there is a fall or else collapse of a building and that collapsed building falls on a child, at that time also this kind of injury can happen. If there is a long lasting compression of the affected area, which could happen if the patient lies unconscious for a long period of time without any intervention, this prolonged immobilization following in fall could also lead to this problem. Hence, it's very important that fractured limb should be kept elevated, offloaded and in a proper way in order to prevent this kind of symptoms. And still, if you feel this kind of any symptoms are coming, make sure to see your doctor as soon as possible. So friends, this was a brief information about possible complications of the fracture. Make sure to like this video, share this video with your friends and family members who have kids who are going through fracture, and don't forget to subscribe to our channel for more such health information videos. On that note, see you in another video. Thank you.